Chiang and Chirag Shah are back on CareShip for our Q2 healthcare report, breaking down where the money, the buyers, and AI hype actually stands right now. From mega rounds and maturing enterprise buying cycles to the RCM gold rush, this one covers the full state of healthcare AI heading into the back half of 2026. We covered multiple topics such as how enterprise AI buying has matured from does this work to how much can you solve, mega rounds, valuations, and whether growth justifies the hype, the hottest deployment categories, voice AI, scribes, revenue cycle, pharmacy, and supply chain, and finally copilots versus automation, generalist LLMs versus healthcare models, and OpenEvidence's physician-first playbook. I couldn't be more excited about this episode. Chirag and Ian are two of the sharpest minds in healthcare investing, and every conversation with them is a masterclass. Guys, the Court 2 healthcare report, I wanted to kind of go into the starting question and making it really broad. What were the single most important developments in healthcare this quarter that you've seen since last quarter and maybe late 2025?
Look, where we've seen a lot of movement and a lot of activity the last couple of quarters has been, I would say, the very practical nuance and like data-driven buying cycles coming out of the large enterprises. I think we went through a wave a long time ago where AI was still relatively new, where people were trying to understand where it fits into their broader workflows and systems and processes. And now that we've done a couple of early deployments across the board, doesn't matter which big entity you are, doesn't matter which part of the workflow you're looking to deploy a solution in. I think that market has matured in a really nice way where the signals are becoming more clear. The way in which enterprises evaluate new opportunities is becoming more because everyone's a lot more familiar with it. And now the question is more so turned to how are you addressing more and more of the problem that any one of these large entities has, as opposed to what is this? Is it going to work? What are all the bad things that can happen, which yes, is still of course a part of the buying decision. But I think there's a lot more clarity from large enterprises on what they need and what they're looking for and how they're going to go about evaluating it.
I'll add to it. Maybe a couple of the other emerging trends we're seeing. Maybe start with the capital market, right? Like we continue to see larger and larger rounds being done. So there's definitely a concentration of capital. Many of the companies, we have seen OpenEvidence raise several rounds that are like quote unquote mega rounds. So in very quick successions, as well as even some of the like high flying behavioral health companies, right? Like the psychiatry, the growth therapies all raise at over $100 million. And then even from the Flair portfolio side, we were able to see even one of our AI platform company, Qualify Health, right? When they were going out to fundraise, first they were preempted and then they ultimately settle on a round size that's significantly bigger than what the company initially went out to raise, right? So there's clearly continue of a trend where there's capital concentration in terms of the perceived winners in the market. On the other hand, I do think that there are still some open questions about the exit environments, right? So of course we continue to see some, hopefully with some of the IPO markets continue to open up, like with SpaceX and also OpenAI as well as Anthropic's pending IPOs will further open up the IPO markets. But we continue to see some of the trends it's definitely improving, but there's still probably a long way to go. And maybe lastly, I would just double down and highlight Chirag's comment, right? Like AI is now really embedded into some of the operating systems. So I know we will talk about some of the use cases later on. On the provider side, I think there's generally a broad adoption of the AI solutions that even faster than some of the other industries. Like healthcare used to be a lagger, and now in some use cases, healthcare is leading the way. We are also seeing on the payer side, right? So Flair, we have a number of payer strategic LPs. So we're also seeing that payers are now picking up their pace, right, to implement AI solutions. Almost like going on to compete against the provider for the AI arms race, right? So, very encouraging to the market, I would say.
Yeah, you mentioned all of these, like a lot of these rounds and getting valued. Do you think a lot of them are mostly justified, or do you think the market is very hyped with AI currently? Like, what is the state, I guess, of healthcare AI at this point when it comes to the investment angle? And do you think that's going to be increasing as well as we kind of see more rounds and more founders going in fundraising?
Obviously, valuation is a relative benchmark, and you can also look at how Palantir is being valued in the public markets, right? So I think there are always, kind of different comp baskets you can build. I mean, of course, on the healthcare side, we tend to be a bit more cautious and more valuation sensitive, but so hard for me to comment on whether or not I think in the venture space, we're always investing in company that needs to grow into the valuation. The growth rate is probably the one that will eventually define the company, right? Like I think, take a parallel Anthropic, maybe not that we never looked at Anthropic since we were not a generalist tech investors, right? But I'm sure I talked to people in the early days, I thought Anthropic was very expensive, right? But they were able to grow. So I think for us, we're looking at that kind of a escape velocity, the growth trajectory. And I would say maybe even compared to like a few years ago, right? Many of these AI companies are growing at an astonishing rate, right? Like Qualify raised a large round because of the strong commercial signal, probably one of our fastest or top 2 or 3 fastest portfolio company going from and with the pace of the growth, right? But we have also seen many of the companies, whereas several of the companies on the life sciences AI side were able to, even get to 0 to maybe $5 to $10 million in ARR in the span of 6 to 12 months, right? So I do think that AI and also the receptiveness from the buyer side, it materially changes how the way we looked at valuation and how do we estimate the growth of many of these healthcare companies.
Yeah, I think the way we think about it, what is the company doing now? What are they going to do soon? What do they want to do down the line? And all of those for us end up being a triangulation of what is the company worth today. By some measure, you could argue that there's a lot of companies in healthcare who are overvalued if you simply look at what do they have right now. But as venture investors, we always are looking at what will you have, what do you want to have, and what do you want to build over the next 1, 3, 5, 10 years. And that's what gets us excited. And so to me, the question is less about are companies overvalued or undervalued? It's like, what do you actually believe about what they want to build? Like, what is the probability or likelihood that you think that the vision that's painted in front of you is going to be a reality? And that's the work that we have to go do to figure out. And that's the piece that either helps us build conviction or say like, you know what, this is actually not going to be something that we think is feasible. So I look at it more so from the lens of, do we believe the world that a founder is pitching? Do we believe that that's something a company can grow into? And if so, I think we're all going to be really happy. When I say all, I mean the founders, the investors, the management team, like the customers, everybody. And if not, look, like that's one of the realities and nature of venture. So I think the valuation piece is one part of it, but like the parallel and tantamount part to me is what's justifying it and like what is the story you're trying to promote that suggests like we're going to go in that direction.
Yeah. Going into the first topic here, which is kind of relatively to vendors and in proportion to them selling to health systems, what are we kind of seeing when it comes to health systems actually deploying AI currently at scale? And what are they looking for specifically when it comes to the current technology?
I'm not sure there's much preventing it anymore. I think a year or two ago, there were things because technology is still relatively new and people had concerns about how and where to deploy it. I actually don't think it's a question of what's preventing them. I think it's more a function of, are you painting the right story to align like where the needs are? And it's an age old problem to be clear, but I think this is actually more about if you believe the cost to build has gone to zero and the marginal cost of new product creation has like gone way, way far down, what are you doing as a company and a founder to make sure you actually are hitting on all the needs of your customer as opposed to focusing on the first thing that lets you walk in the door? So I think it's actually more around how companies are set up to keep up with the growing list of needs of a large enterprise rather than what the enterprise could be doing more of to sort of promote said deployment.
Yeah, I will agree. And specifically to some of the use cases, right? Like I would say we continue to see ambient scribe adoption, and that's almost becoming table stakes, right? Of course, Flare, we invested in a company called Suki, we saw firsthand. And also coding and billing and anything along the like across the RCM workflow, there's a lot of AI excitement, right? Like and Flare, we had the good fortune of seeing the phenomenal growth of a platform like Smarter DX. And then there are also, of course, like prior auth, patient engagement, payer engagement, and some of the navigation tools. So to Chirag's point, I don't think there's any blocker in terms of I think Menlo done a survey like last year, right? Actually showing that health systems providers have a greater AI as a whole than the typical US economy, right? Like so I think it was like 27% of the health systems actually have paid commercial licenses for AI applications, right? I do think like, look, we all want AI to be adopted faster, right? So I think this is a generalized comment, not just a health system one, but just in the B2B enterprise side, right? So a lot of the time it's the knowledge. It's also the people on the implementation side, right? So that's what we're starting to see. OpenAI is building their own like kind of a consulting team, whereas Anthropic formed their own business. And the forward deploy engineer model, which Palantir famously, kind of took it to mainstream. I think that's becoming more table stake, right? And in the health system side, or anywhere across the healthcare workflow, I think generalist implementation firm or technology implementation firm just may or may not cut it. So I think if there's an area where would need to continue to be invested both at the company level or maybe new categories of the companies, right? It's really how to drive some of these implementation adoptions to accelerate the adoption of AI tools all across the entire healthcare ecosystem and health system in particular.
Yeah, you mentioned a couple of good points there. I wanted to kind of break into the FDE model because there was a podcast I was listening to yesterday, and they mentioned a lot of companies that use the FDE model, and it could be different healthcare this might not be the best idea, and it could potentially not be it could actually be negative for the company. Do you think it can go both ways in healthcare where you're at the customer side working specifically for their workflow? And is there a negative to that kind of model as well? What do you think on that category?
Yeah, I would say, of course, anything could cut both ways, right? Like, but I would say healthcare has a very specific kind of workflow norms, as well as there are data privacy and other kind of concerns that are uniquely healthcare related, right? But also, of course, we're dealing with the providers are often dealing with life and death, right? So that's why I think, of course, some of the first waves of adoption tends to be more administrative focus, so lower risk and safety. But in order to drive broader adoption, right? And this is always something I have learned even when I was a consultant, well, when I went to business school, where innovation as well as technology fall under the operations and the transformation vertical, right? So I think for the FDE models, like if you're just like someone who has never operated in the healthcare environment, you're likely going to run into a lot of friction. And I personally have learned that as a product person, right? Like so in my past life. I think where the smarter companies and also many of the solutions, and this is why I think you will continue to see many of the healthcare AI companies in our space are going to build their own FDE teams or forward deploy product management team, right? Because I think uniquely you need to map out the specific workflow, and the certain workflow may even vary from one health system to another, right? So I think, like, of course, if you just try to implement like a generalist FDE team, it might go one direction, right? Whereas if you have a trusted party focusing on FDEs, right, like, and who are fluent in healthcare and have that provider as well as administrator empathy, I think that can help drive adoption way faster than, what the market we have seen in the market.
Going specifically to categories of vendor types and in healthcare, which one specifically crossed the quote unquote chasm from experimentation to budgeted purchases in? And you were talking about this, Ian, about the scribes and the administrative stuff. Is there anything maybe potential strategic LPs are telling you guys when it comes to we want to see this specifically in our hospital or in our payer side? Like what are those specific things that you guys are seeing from LPs or potential people that you guys are speaking to at these health systems and stuff like that?
Yeah, I mean, I think from at least my standpoint, the three or four areas that maybe four or five areas that come to mind most readily here that everyone seems to be looking at is applications of voice AI, sort of to handle patient inbound and outbound. I think there's been a lot of interest in automation and automating like rote processes that folks don't need to spend as much time or resources on, which is distinct than AI, but process automation for sure. I think pharmacy has been a very big one.
Yeah, I see that too.
Yep. And I think probably the last piece is rev cycle. So
Mm.
those are probably the big ones that just come up time and time again. A lot of that is geared toward the provider side of the house. I do think the payers are probably a step behind, but I think they have become much more interested when it comes to their administrative workflows. So things like compliance, operations, regulatory, less so on like care delivery or the MLR piece, but certainly on like the admin stack they've shown a lot more interest in.
Yeah, and I'll add to. I agree 110% with Chirag's all the use cases and maybe a couple other ones just to add. I do think that we're starting to see a lot of health systems are interested in use cases and in supply chain as well as procurement, right? Like, so I know those are probably not the sexiest like departments within any organization, let alone with health systems. And yet there's so much of spent, right? Like, and also people involved. So we're starting to see many of the use cases of targeting those kind of expenditure where there's a high labor cost or high labor spend, and then yet there's a underinvested when it comes to technology investments, right? So supply chain procurement, and maybe one other area I will add is there is going to continuously going to be a need when it comes to navigation, right? So in addition to maybe building on top of the patient access, but there's always going to be the downstream navigation all across the healthcare system to continue to make sure that improve the patient experience, but also ensuring that the patients are staying within the health systems, right? So there are some of the patient experience, other use cases in addition to the front end, like maybe the call center automation, scheduling. There's also the downstream kind of navigation that's
Okay.
emerging.
It kind of going to like the next topic here when it comes to agents and co-pilots in healthcare. We see, I personally am seeing a lot of startups kind of talking about how obviously they're not replacing anybody in the front staff and I'm seeing it a lot much more frequently now is that we're just helping with obviously facilitating and expediting work for healthcare administrators. Do you think that's going to be kind of lasting? And do you think there's going to be more of an automation sphere where maybe the startup might not say like we're going to automate. I mean, they're going to automate XYZ, but they're not going to. But the health administration might like the health system or private practice might not specifically, you know, fire that front staff or whoever. Do you think that's going to be like a increased trend, or do you think it's just going to be clear on AI just assisting? health administrators.
Are you getting at the distinction between like labor replacement versus augmentation?
Yeah, pretty much.
Yeah. Look, I think this is a question of what is the use case and what is the best use of time for everybody. I think health systems, like any other employer organization, are very loyal to the people that they hire. And at the same time, I think they are always looking for better ways to do things that they've been doing. If that means they're going to move people to different departments and reallocate that, then great. But I think when companies in the AI world, whether we're talking about provider, payer, or elsewhere, when they are pitching, solution, and you can pick your favorite area, I don't know that the immediate play or the immediate like messaging is, you can replace all of these people. It's
Right.
here's where we can do something that you need better or more efficiently than you've been doing it. And it's, your decision as a company for like what those folks do now. And there's a lot of jobs to be done inside any of these companies. And so I think that ends up being more a question of what the health systems want to do than it is what some of the startups and earlier stage vendors want to do.
Yeah, I think they, at least from my perspective, I think in the near term, it's hard to see any sort of quickly replacement of the people. So I think I do certainly believe that many of the AI tools are more going to be in the co-pilot mode to help augment the staff, right? I think in the midterm, like as AI continue to mature, like for some of the departments, like for example, natural attrition will occur and you may not need to backfill some of the roles, like then you can accrue some of the cost savings, right? And then in the long term, maybe much, much further down, then we can truly reach that automation kind of the nirvana state. But I do think that one thing we have to be very careful thinking about, and this is something I will caution, be it entrepreneurs as well as even our fellow investors, right? I have to keep on reminding myself because while we all believe in automation and the possibility of the technology, and frankly, some of it is like technology is perhaps even more mature than the change management that's ready for it, right? I think healthcare, oftentimes when we see some of the innovations when it comes to workflow, it tends to receive some pushback from the different parties involved, right? And it is a union. There are different parts of healthcare that unionized like workforces, right? So I think to drive any technology adoption, I think with the innovation in general, you have to engage the key stakeholders, right? I always remember when I was a consultant many moons ago, like even for call center operations and some of these, right? Like for nonprofit, like client of ours, they would get calls from the governor or the mayors of the city that they are in to tell them not to lay off people, right?
Wow.
Since it was right around holidays, right? So there are different forces involved, not just a purely inefficiency at play, right? I mean, U.S. economy is 18%, healthcare is 18% of our GDPs, right? So a lot of jobs are tied to it. So in order for us to truly take out, FTEs or labor costs, like I think there's a broader like job and forces at play, right?
I wanted to kind of talk about another kind of key concept here in revenue cycle. I see this a lot, whether that's like startups focusing a lot on like a specific segment of revenue cycle or kind of, focusing on prior auth or just tackling the whole cycle. Why are we seeing so much capital flowing into RCM? Is it because it's like a big space or like it's a big market in general, or is it just that big of a problem? Like what is the kind of, I guess, the category defining, I guess, market movements that we're seeing in that space?
From my vantage point, and if by revenue cycle, you sort of mean like the entire flow of like claims and payments and sort of how we think about purchasing drugs and services, the reality is like pretty much every dollar in healthcare goes through it. Yes, there's plenty of stuff that consumers pay for on their own, and we've got deductibles and whatnot, but so much of the dollars in industry flow through it. Hence why there should be a lot of focus on making that process more efficient. And if you were to really sort of look down the line at what a quote unquote ideal state would be, I'm sure that you could find lots of people who'd say we shouldn't need any revenue cycle. Like that whole industry like shouldn't be there because we should be able to agree pretty quickly on what somebody came in with, what the provider did, what the payer owes, and call it a day. The reality is that's nowhere near that simple. And so, when you think about how this industry got stood up, a lot of it was based on manual review of like people reviewing charts and documents and rules and hundreds of pages of books to figure out like what something meant and whether that warranted payment. And I think this has been one of the most natural places to deploy technology in healthcare because it is based on a combination of, legacy tribal knowledge, nuanced rules that are unique to every payer and provider, a slew of standardized materials that everyone in the industry looks at. And I think that confluence of input data is a fairly natural place to be using LLMs. And so the use cases to me are fairly natural. Like I'm not surprised there's a lot of companies going after it, A, because it's a big market, and B, it's a great use case for LLMs. That's also why there are so many companies going after it, which is the converse of what I'm saying. Rev cycle is a lot of different things. And where you decide to focus on that spectrum is more a matter of where you think there's an opening and where you've got some expertise. That's the piece that I think will separate people. So I think we're going to continue to see a lot of companies focused on this. There is some nuance as far as like what exactly revenue cycle means and
Right.
which part of it people are spending time with. But it is not at all surprising to me that we're seeing a lot of activity here.
Yeah, maybe if there's anything to add, I would say the human behavior, well, maybe even just at a board, right? So when we often look at companies, we look at their revenue growth first, and then look at their other performances, and then you look from top to bottom of an income statement, right? So I think it is natural for companies to invest in like what will drive revenue growth first and foremost, and therefore any of the technology or solutions and services to support that usually get disproportional amount of attention, right? So RCM is what drives revenue, right, in healthcare ecosystem. So that's where, or just maybe the saying follow the money, right?
So true. I mean, I guess kind of moving on here, kind of go into like healthcare AI as an overall infrastructure, will, I guess, the biggest winners be in healthcare be applications or the infrastructure underneath them? What are we seeing there?
I think it's hard to say. I believe healthcare is big, such for what, like $4 or $5 trillion market. So you're going to have multiple winners, right? So I know it's kind of a cop-out answer. So I think depending on the definition of winners, even EMR space, I know Epic is one of the leaders, but you still have the Cerners, the Meditech, and also on the outpatient side, you have the Greenways, and then even some of the newer ones coming up, right? So I think it is a big enough of a market that you are likely going to have multiple winners. So I think on the infrastructure side, right? So clearly we were very bullish and excited about like Qualify Health as a potential winners in the infrastructure space that really focus on the governance as well as the safety and the quality layer of helping health system adopt AI across the ecosystem, right? But it doesn't mean that application layers cannot have like large winners, right? I think take a parallel of just a broader tech ecosystems, right? You have the infrastructure layers of the hyperscaler, the cloud storage providers, right? They tend to be more consolidated. You have AWS, Azure, and maybe Google Cloud, but then there are plenty of large application companies, right? So I think you can have winners across different parts of the technology stack, right? Across technology, and health tech is no different from any other vertical or any other technology segment.
But to me, it depends a little bit on what we're calling infrastructure versus application. I think as far as, whether there's one, I generally agree that there's room for a lot of people. It's quite a big sandbox. I think at the same time, a lot of the work in healthcare happens at the application layer. And again, I'd maybe go back to the framing of the question of like, what is infrastructure here? If infrastructure is OpenAI and, Anthropic and
Yeah, like the big guy. Yeah. Exactly.
yeah, then I think in my mind, there is more of a reason to build healthcare specific workflows and processes at the application layer, because that's where the work in our industry is going to happen. And that's at least where, certainly we're spending a lot of time. I do think there is opportunity on the infrastructure side, but I think more of the interest we've seen from larger enterprise in the industry has come from application side products and tools where, we can see a more direct and immediate impact on bottom line.
Right. Do you think though, that on the infrastructure side that I guess healthcare is due for like a specific LLM kind of thing meant just for healthcare and the life sciences? Like, do you think these large frontier labs do pretty good, or do you think like we're gonna start seeing? I mean, we definitely are seeing a lot of these LLMs specifically for healthcare and things like that. Do you think that's going to be a huge thing as well, or do you think it's just going to be mostly the frontier labs?
I think there has become less and less of a need to have a frontier model specifically geared toward healthcare. I think the large labs have done a pretty darn good job of this, and most of the applications and use cases that we need have been reasonably well served. There are probably some exceptions here. I could see some exceptions, at least on the drug discovery side, if you're talking about really complex or rare disease, areas that are super nuanced where there really isn't a whole lot of existing data to build on. But I think for most of the use cases that we're seeing a lot of activity for, the foundation labs actually do a pretty decent job at serving that market.
I mean, for example, like a benchmark, like if we look at the benchmark of like what the frontier labs say, it's like weird because like the healthcare one is always one of the lowest. And I was always wondering like if the healthcare benchmark is one of the lowest, maybe you guys can explain it more to me and maybe I'm a little bit naive on that. Is like why is it lowest? Is there like potential room to make that like specific benchmark higher?
I think this goes back to what the application is. If you're talking about clinical reasoning, that's one thing. If you're talking about how do I automate a prior auth workflow, that's another entirely. And that to me is not too dissimilar from the benchmark you'd apply in another industry. I think looking at a benchmark for a sector is misleading. I think it's got to be a benchmark for a use case. Like, are we automating a defined process with like a clear SOP, or are we trying to apply, reasoning to some fairly complex problem? And I'd bet if you create that same analogy across other industries, you'd see similar disparities in benchmarks. So I think it's more around like, what are we really measuring when we say healthcare?
Yeah.
And is that the entirety of the use cases that we think are going to be of most importance?
Uh, this is also so to your question, right? Like I think be it earlier this week or last week, there's even an article published about general purpose large language model outperform specialized clinical AI tools on medical benchmarks, right? So I think they
Right.
compare Gemini like 3.1 Pro, GPT 5.2, Cloud Opus 4.6 to OpenEvidence up to date. So clearly, I mean, again, right, this is at this moment of time. I think as we have seen many of these models continue to go back and forth, right? But clearly a generalist large language model can perform quite well. But to Chirag's point, I think on the life sciences discovery side and the research side, where the data sets are not as open to be, to large language model to be trained, right? So a lot of the data are residing in be a large pharmaceutical life sciences company research labs and other places where I do think that specialized model, maybe you wouldn't call large model over
Right.
the years. Like I looked at a number of companies, for example, like spectrometry, like data sets, right? So all those are, you really need proprietary data to train the model to outperform, right? So I do think that there's going to continue to be emergence of very specific models for very specific use cases within healthcare, right? The other aspect, I think this is again, I haven't looked deep into it, but the cost aspect, right? Like, so sure, there are many use cases you can use a generalized large language model, but oftentimes, like, it's not cost effective, right? So I think you should
Right.
always layer that cost component to it.
Absolutely. Kind of moving on here, kind of going into like the more of the business model or like what AI is kind of doing to these startups in general. Do we think that healthcare outcomes right now are too complex for like pure SaaS and we're kind of going to like the usage base also in healthcare? I see it a lot in general. Or is it just pure kind of also SaaS as well in healthcare?
This is another one where, at least to me, it depends on the use case because I've seen them both. I think
Okay.
a lot out of the gate, like any company, it's really hard to prove value and prove ROI. And so companies will often, from my scene, they'll start with like a more of a usage-based model, which will be relatively low and honestly meant to cover costs. Over time, when they can actually demonstrate ROI, they can flip to more of like a SaaS type pricing. But this is one that I think just evolves with the use case and sort of exactly what the company is doing. But that's the short answer is a little bit of both. And the longer answer is like it's more of an evolution in terms of what you can prove and when.
Yeah, I think there's definitely a trend towards usage-based pricing, right? So I would say maybe we wouldn't go as far as saying SaaS per seat-based pricing model is dead, but I think in especially, I mean, look across the board, right? Like health systems are running as like single-digit margins. Health plans are also running at single-digit margins. So almost every single one of the players in the healthcare ecosystem, short of life sciences companies, are running at very thin margin, if not at times like negative margins, right? So I think performance-based pricing, so usage-based pricing is likely going to be the trend of the day, right? Like I think a lot of per seat based pricing historically has to be like it's easier from budgeting standpoint, right? Like but I do think that as we continue to progress and evolve, I mean, look, even the consultants are now evolving their business model tying to performance, right? Rather than based on projects. So I think that's just a inevitable trend that we're moving more and more towards that usage and performance-based pricing.
Interesting. Chirag, I wanted to ask you, kind of in the prior auth stuff, we saw the CMS launch a major push towards electronic prior auth, and we're seeing this like crazy. And I guess the broader goal is to move prior auth from, I guess, fax to like API-driven workflows, making it much more compatible. Is this is this the beginning to the end for manual prior authorizations? And what are you seeing overall in that?
I think I think prior auth, for better or worse, has become one of the most central parts of our sort of healthcare delivery process. It is something that drives so much of what we spend time and money and resources on from like a provider, a payer, and a patient perspective.
Yeah.
And so I think the very first thing to think about here is like it's really important we get it right. Manual versus automated to me is not the question I think about. And it's more about how can we make sure we're making the right decision most frequently, coupled with how are we doing it most efficiently and quickly so that the people who really need some of these services can get them when they need them. We, alongside Flare, spun Cohere out of Humana for this purpose several years ago. And as you noted, they've been a part of CMS's initiatives around prior auth. And we think Cohere has done a really fantastic job in helping standardize some of these processes and making sure that patients and providers and payers all get what they need. So I would say the primary goal here is to ensure that we are delivering prior auths accurately and irrespective of which means that comes through. But first and foremost, I think it's about let's make sure the patients are getting what they need, that we all agree as payers, as providers is also necessary and needs to happen, and then we can figure out the how part.
I wanted to kind of go into something interesting that I've also seen is more under regulation. A lot of states are increasingly using, I guess, healthcare AI rules, while a lot of federal agencies are continue building a lot of these oversight frameworks. We saw like Commure raise at a $7 billion, mostly in administrative healthcare AI. I guess that's such like a big health category in general, and they're kind of pushing in a more horizontal path. Do you think, I guess, or does administrative AI kind of become at one point bigger than clinical AI? And we kind of talked about this as well, but what is that, I guess, market size for administrative versus actually at point patient care?
I think like administrative has been, I mean, I don't actually have the actual market size number in front of me, but I think administrative AI from my kind of observation is already bigger than more the clinical AI in terms of the use cases and the readiness for adoption, right? I mean, look, unfortunately, US healthcare, due to many of the structures, right, like RCM is included in, could be also bucket in that administrative bucket, right? Like,
Right.
so it is like, until we revamp the entire healthcare ecosystem, our healthcare infrastructure, like healthcare system, administrative is going to continue to play front and center, right? And that's also one of the areas where I think we need to use technology to make it more efficient so we can reinvest back the savings to the clinical side, right?
I think the reason why market size ends up being hard here is because embedded in this is where is the more immediate place you can make change? And I think the truth is we all as an industry felt more comfortable making changes in administrative places, whether you're a provider or a payer. That doesn't mean there isn't opportunity on the patient facing and care delivery side. It's just a question of which of these markets goes when. And so I think at least my personal belief is that I just think there's going to be a lot more scrutiny and a lot more it'll take a little more time for us to deliver the right results and create the right environments to do this on the patient side. I do think there's a big opportunity for it. I just think it's a little more straightforward when you're doing purely administrative use cases versus getting into clinical.
Final topic here is I wanted to talk about, I guess, the hardest healthcare company right now, OpenEvidence. They're massively valued. We talked about them a little bit at the beginning. Is my main question here is physician facing AI, is that becoming bigger than hospital facing AI, if that makes sense, when physicians are using it more mostly than overall generalized hospitals?
I guess I find it a little tough to separate these two because a lot of what the administrators buy, the physicians ends up using. Think about a coding solution, right? You're going to have your VP of Rev Cycles, CFO, whomever think about like what's the right use case, where the right specialties, where you're going to deploy. But if it's like a concurrent product, you're going to see that in the workflow of the physician. So whether they hit dismiss or approve or modify on the recommendation is neither here nor there. But I would call those deployments, I don't know, equal or heck, even more heavily weighted on the physician given the number of users. But I guess it just depends on how you split those up.
Yeah. Because I mean, you can have like private practice, I guess, health, I guess, providers using it versus just, I guess you kind of mentioned it and hinted it on. Maybe Ian, you have a different way of kind of talking about it. But like you have a lot of private practice physicians as well, and then you have a lot of obviously in hospitals and different places. What do you think about that, Ian?
Yeah, I would say, I mean, so it's interesting. I think a lot of VCs or even entrepreneurs and maybe entrepreneurs, like in order to raise capital, you always want to sell large ACV contracts, right? Because us like VCs, we do care about large ACVs. So we tend to see a lot more of, or hear a lot more companies that are selling into the likes of like hospital or the health systems, right? Like more enterprise B2B or B2B2C kind of go-to-market solutions. But I think what OpenEvidence and even before OpenEvidence, Doximity, right? Like two of the best performing companies like over the last decade or so, all started with that physician, like the physician facing selling individually. And I think one thing to remember, right? Despite the consolidation of the providers, like becoming more and more employee docs, still 55% of the US physicians are independent, right? Like work in private practices, and many of those private practices are, your onesie twosie, right? So I think that it's just a different way of going to the market. And having been, I study under Clay Christensen, definitely, and like one of the firm believer in the low end disruptive innovation, right? Sometimes some of the best innovation goes from lower end to the higher end, right? So I think it is to be shown that it's okay and sometimes even better to start selling into more of the private practices or even physician individually in terms of OpenEvidence. And then as the product and the market matures, you move up the sophistication curve, right? And then to become more enterprise solution. So I think we're now seeing OpenEvidence. Before Daniel highlighted, he's very focused on making sure the physicians use the tools, right? So, but now there's commercial signals that they're striking enterprise level deals, right?
Well, thank you guys for this. I appreciate this, and we'll come back maybe potentially next quarter. Thank you guys. Appreciate it.
Thanks.
Yeah.
Thanks, Chirag. Nice chatting.